So I'm mainly doing this presentation because I feel like a lot of us have different certifications or have gone through different protocols. So some people have done Melillo and some people have done functional neurology and some people have done Dr. Josh's. And there are a lot of great pieces from Melillo that we love, but overall we're not a Melillo clinic. We don't specifically work on only hemisphere specific stimulation, but I do think when it's appropriate, it is really, really beneficial. So just making sure that we're all on the same page of when we use specific hemisphere stimulation and when to more take like a global approach and utilize a lot of the tools that we have in the office. So these are just some of the examples of input that we can do or stimulation that we can do for a child. So some of those include light, sound, vibration, vestibular input, adjustments, smell, range of motion, vagal stimulation, specific eye movements as well. Calorics, I don't know if how many of you are familiar with calorics, but basically that's taking a syringe and putting it in a child's ear or in a patient's ear and then shooting it with either cold water or warm water depending on, and the specific side depending on the case. And basically that just helps activate the vestibular system. Utilizing direct current is another one, and then oxygen and laser therapy. So this is, again, just making sure that we're utilizing this in an appropriate manner of, okay, when we have a kid come into the office, if they can't walk or they are really low tone or they are kind of in a really severe case, this might not be appropriate for them. But it's figuring out, okay, what does each child need that's going to really help integrate these reflexes. So basically, I just wanted to summarize, when is it more of a global weakness and when is it more hemispheric? And basically, when a child comes in that has global weakness, a lot of the times we'll find bilateral findings, poor muscle tone, and they'll fatigue really quickly, and they obviously won't respond to specific stimulation. Whereas hemisphere specific would be they have more unilateral findings and they respond really well to specific hemisphere stimulus. So then I broke down two different pages here of what right hemisphere stimulation looks like. So vibration, sound, and light, those all cross the brain. So if we're doing these on the left side, we're activating the right hemisphere, as well as adjustments. Smell is one that doesn't cross the hemisphere. So if we're putting essential oils on a child, we're putting it on the right column or the right color of their shirt. For optokinetic strips, so we have the iPads that have, oh gosh, does one of you know what the app was called?
Okay, and drum.
Yeah, Focus Builder is another one too that we've utilized in the past. But there's an app on the iPads or even on the NSI that have these optokinetic strips. So if we're moving the strips to the right, meaning the panels are going all the way across to the right, so the child has to pursuit to the right and then saccade to the left. That's going to activate that right hemisphere versus the opposite. And then lastly, spinning is another tool that we utilize in the office that is a hemisphere specific tool that we can use. So meaning we slowly spin them to the left, and when we say slowly spin them, this is extremely slow. They should not have any nystagmus in their eyes when we're spinning them to the left, meaning it takes 3 seconds to do a full rotation on the swing. So they should not have nystagmus to activate this, this spinning on the left. You could also do lateral acceleration, so meaning we put them on the chair, right, and we move them really fast across the hallway with their left ear forward So we're activating, again, that left vestibular system. And then we can also spin them really, really fast to the right. So I just kind of wanted to do this presentation to clarify like when it is important to do hemisphere specific and what you can do and all the different modalities that we can utilize in the office that are going to help each child. And each one's very specific, right? We might be able to do vibration on one kid and it integrates reflexes, while the other kid might need light and sound. But it's really, really important that we go through all of these before we start incorporating laser therapy, before we start incorporating oxygen, right? Because if we start lasering their brain and giving their brain enough of the fuel and energy and all of that stuff before we check all of these things, well, you might not get the appropriate response from the child. So trying to check all of these things before we start incorporating a bunch of other stuff that we can't undo is going to be really, really important.
Yeah, especially like initial exam. I think like during either initial exam or when you're like their first part of their first session, like checking these things and just seeing what changes their reflexes, because it might be like, checking these things right away, because you might find like vibration improves their ATNR, and then light improves their ATNR, and XYZ improves their ATNR, and now you can go in there, know, okay, if we incorporate light and vibration and smell during all their therapy, like the whole week, they're going to integrate more appropriately. Mm-hmm. So, yeah.
Anyway, that's all. Does anyone have any questions on any of this?
I think we should get it printed out.
Yeah, you can definitely do that.
I don't have a question, but will you go over for those who haven't done Malilo how you would test with light and sound to determine
Absolutely.
which side to work on?
Absolutely. Do you want me to move to do that, or do you think I can just do that up here?
Do you want me to do it? You can do it here. Do you want me to?
Yeah, I would love that. May I steal this?
You may.
Sorry.
You're fine.
Metronome. Does someone mind grabbing that? Well, I don't.
Pretend.
Okay.
Tick.
Okay.
He's got
Yeah.
So sure, I'll just pretend. It's fine. So when we're doing light, we want to aim for the inside corner of their eyes here. So if I'm utilizing a flashlight or a phone, I'm going to come across Abby's ear and go right into the corner of that eye there. So I'm going to do this about 15 times with the metronome on. And then I'm gonna recheck her reflexes. But it's super important that you have a baseline, you check their reflexes and then do this to truly see if it is making a difference. If you never check and you don't know what their first thing looks like, and then you go and do this, you're not gonna have a good understanding of if it's really benefiting the child. So if I'm doing it on the right side here and I recheck her ATNR and it looks better, well then stimulating the left hemisphere is gonna be the most beneficial for this patient. And then
That's because when you look at the eyes, the right side of the right eye and the right side of the left eye goes to the left hemisphere, and vice versa. So when you bring that in across this side, you're going to hit that right side of that eye, and then you're going to hit the medial side of the left eye.
yeah, so that's why when we have the eye lights, it's important that we utilize the right side of both of the.
The red is going to be more for the left brain, so the red is going to fire on that right side of their eye, and then on the medial side of their left eye, and the blue should be the opposite. So if you turn it on and it's not that,
Switch it.
yeah, you got to switch it.
They're not
Yeah.
pre-programmed.
Yeah, so it's pretty easy, but again, if you guys are working with a child for the first time, it's really important to kind of go through all of these different modalities and figure out which one's the best for each kid. Because the first day is the most important, and in a new patient exam, we don't have enough time to go through all of these things. And again, it is dependent on appropriateness, but we don't have time. We can't spin a child in the new patient exam, right? So as a therapist, it's really important that you guys take that initiative to go check these things and see what works the best for that kid. That's all.
Thank you.
We can get a printout of this too.
It's like consistently and regularly throughout the session, like see what's making change, and that helps you like summarize things with parents so much better. Like, hey, when we started, ATNR was there, but then we were able to integrate that or get them to inhibit that reflex in these 2 hours with this modality or whatever. Like that alone takes 10 seconds to tell them, but that like teaches them so much about their kid, let them know you're being specific, but it also gives you like lots of hands-on experience check-in reflecting. So like it's kind of annoying for like Green to get up on their hands and knees or something like that every once in a while, but it's not a big deal. Like it's something that gives us good practice and helps make sure we're steering the ship the right direction, but also helps give like reps for check-in reflexes and like trust your gut and your instinct and just like get reps.
I would say too, like even checking them continually after they're integrated, because I've had like some kids where one day they're integrated and then they don't look great the next day, and I'm able to talk to parents and be like, did they eat something? And they're like, oh yeah, they actually had this, and then I'm able to say, well, like it kind of gives more of like a concrete like evidence for them of like, oh, maybe that isn't great for them. Like they're not just saying to be gluten-free, just be gluten-free. Like it actually does affect them. So
Yeah, for sure. And for going home, like you can say, yeah, well, this would be something great to integrate into their home plan of like, use light while you're working on these reflexes, use sound, use whatever while these are things we found to be beneficial in the office, use these at home as well.
Yeah, you don't want to give parents a light and sound protocol if light and sound never affected them.
Yeah.
That's a waste of their time, and
Yeah.
that's not.
So is the idea of light and sound is just finding a quick way of what side of the brain you can stimulate in order to shut down those reflexes?
Yep.
Like that side of the frontal lobe needs to come back and shut down.
Yep.
So like, from my understanding, Malilo says autism is more right brain. So like, we have a ton of kids with autism, so are we still, let's say we do that and we see left side is more we want, like we see that help with reflexes, would then you'd be like, okay, we're just gonna global, because the right side we still know, or like, what does he mean by right side? He's usually,
Right frontal lobe is more often involved with autism, but like, I would say if you go and stimulate their left frontal lobe and the reflexes go away, you're on the right track.
Okay.
Like always use their neurology as, like, because you can have left brain autism, you can have 5% of our population has reverse brain. So like what would normally be the right brain is their left brain. So like there's so many,
yeah.
in general, 80% of the time you're probably going to be, stimulating the right brain, but always go with your findings.
Okay.
What changes
I
the
didn't know what you
reflexes,
meant
what
by-
changes their balance, all that stuff.
Okay.
Yep.
Yeah, I
And
didn't know
it
what
comes
you
back
meant
to
by
notes
right
too,
brain.
like if we find something that works like that, put it in so everyone else knows.
Yeah, but like make it bolded,
Yeah.
bunch of stars in front of it, just so we know.
You can even use like frequency of lasers too, like violet and green are more calming and inhibitory. So I've been kind of playing around with doing that more left cortex, and then it's like kids with like echolalia or palilalia or just like a lot of vocal stimming, like they have activity and almost excessive activity on that left cortex where it's just kind of going nuts and it's not stable, it's not functional. So like just like calming inflammation and trying to gain stability there, I think is beneficial. And then I think of red and infrared as more like not brain stimulating, but a little bit more like brain activating frequencies, more penetration, more energy like directly into the brain. And so so even tailoring your laser colors per side is something that I've started playing around with, and I've seen some cool stuff from it.
Yeah, I've seen multiple times where we use like red infrared, make 0 changes to the reflexes, and we use violet or vice versa, and it completely changes the reflexes. Thanks for taking the time to check out this video. To learn more or to schedule an intensive or anything with my team, there's a link below. Just go ahead and click that and that'll get you to the right spot. Have an awesome day.